As I said, it's safe for all ages. Lots of rigorous purity standards that it passes. No known side effects with other drugs and medications, so another good thing. And very bioavailable. As I said, it's easily absorbed across the intestinal tract and used in our bones. Not only that, it's been shown to alleviate skeletal pain. There's been some studies done that because of osteoporosis, you start getting little microfractures that you don't even realize, but they still cause pain. And when we start taking the MCHC, over a span of a year, people who came into this study with pain completely alleviated it. So very interesting in that respect. Another thing, to answer your question, vitamin D supplementation. People who supplemented just with vitamin D3 alone saw a 60% decrease in their rate of bone loss, reduction in their fracture risk. But when we take D3 with calcium, it just magnifies these results incredibly. So with the dosage of vitamin D, 1 to 18 years, we recommend about 1,000 IU, international units per day. 19 and older, you can bump it up to about 2,000 per day. And that's it's been what's shown to be bioprotective for people. So avoiding cancer, avoiding kidney problems, avoiding all these different things that we talked about here previously. And here it says 500 to 800% prevent osteoporosis. The only reason that's there is because that's what the studies have been done on, 5 to 800. But really this 2,000 a day is more, it's even better. So like I said, obviously you're going to be helping your bones, but you're also going to be helping the rest of your body as well. So these are the specific metagenic supplements that we recommend for people with osteoporosis issues or who want to start developing their bone quality and strength in the future. We have the Cal Appetite Plus, and that has the vitamin D actually built into it. Not the full recommended daily amount, but it does have some built into it. And then this is what we recommend for children or people who don't like swallowing anything. Is we have a Cal Appetite chewable, so that's definitely a great product for them. The ISO D3 is what we recommend for our D-supplementation. That's what we sell. And then the Ostera. Ostera is really meant more for women who are past the menopausal, post-menopausal women. It helps a lot with the laying down the protein matrix and really helps boost up that side of production in the bone. Something that Holland was talking to me about earlier today was they actually have a newer, better product out called Appetite Forte capsules. And what this is the MCHC with the vitamin D, but you have to take fewer capsules in order to reach the maximum amount. This gives you about 60% of your daily amount. This gives you way more than 60. This gives you about 200% of what you need on a daily basis so that you are getting enough and so that you can absorb enough through your intestines to give your body the fighting chance it needs to get the calcium laid down. And this kind of shows, we took the graph from earlier and just overlay the different supplements that we recommend here. So for the Cal Appetites, we recommend them pretty much for life. You can start here when you're early and keep taking them through postmenopausal years. But here's where Ostera comes in, about when menopause starts setting in. So we can start building not only the mineral component, but also the organic component, the matrix component. So we need to keep all of that healthy as we continue to age. So we talked about a lot of the specific nutritional factors, the healthy, rich diet, nutrient-rich diet, calcium supplementation with the MCHC and the vitamin D. But we also need other micronutrients, which a lot of them are included in our products that we sell here. The boron, the magnesium. Then we also need things like magnesium, strontium, silicone, and copper. These are all things that are incorporated into our bones from our diets. And then also multivitamins with vitamin C, as we talked about earlier with collagen, vitamin K with the osteocalcin, and then vitamins B6, B12, and folic acid. They're going to be necessary for your hormone production. And then they're also going to be very important for when we talked about homocysteine earlier. Homocysteine is cycled through by these B vitamins. So it will turn the homocysteine into amino acids, actual proteins, and it becomes a lot, it's not as damaging to your connective tissues anymore. So that's why those are all so important. Some other recommendations, daily exposure to sunlight. And as we said, sometimes that does become a problem, especially here, but doing your best to do that and to make sure you have as much skin as possible exposed. Vibration therapy. Vibration therapy is something that's been studied here just recently. It's kind of come into vogue, so to speak, is a treatment for osteoporosis. Dr. Warren, a chiropractor here in Osceola, he does it with some of his patients, osteoporotic patients, and has just great results with it. So that's definitely something to look into. If you have any questions about that, you can talk to me about it. But it kind of goes along with this weight-bearing exercise. If you're doing weight-bearing exercise with vibration thrown in, it gives you a little bit more stress to the bones and helps them develop even further. So, but the weight-bearing exercise in itself is very important. So, of course, we recommend that to everybody. Stop smoking, decreasing caffeine, alcohol, simple sugars, coffee, all these things that we know leach calcium out of bones, but we still do it, and all these things that just contribute to an overall unhealthy lifestyle. Am I saying never? I'm not saying never. I'm saying let's just moderate these things and make sure that they aren't part of our daily routine. So, last thing I want to say is we talk about a lot of natural interventions here. We never want to rule out pharmaceutical intervention. There does become a time and place for that sometimes, especially when I talk about earlier, when you've had their ovaries removed, hit menopause early. There are some things, sometimes when we do definitely need it. But we definitely recommend doing a more natural approach first. Let's try something more less invasive, more natural. If that doesn't work, then we can move on to doing other things. So things like hormone replacement therapy and osteoporosis management. But of course, we always want to start with the less invasive and work our way out. So that is all the information I wanted to cover with you all tonight. I appreciate your coming out and your attention. So what I'm going to do now is just open it up for any questions that we might have. And Nahala Jacobs is here from Metagenics, and if you have any questions about the specific products that we're selling, you can definitely ask her at this